Tuberculosis, TB. Tuberculosis, TB, is a serious, contagious infectious disease primarily caused by the bacterium Mycobacterium tuberculosis. While it most commonly affects the lungs, pulmonary TB, it can also attack other parts of the body, such as the kidneys, spine, brain, lymph nodes, and bones. Extrapulmonary TB. Not everyone infected with TB bacteria becomes sick. Some people have latent TB infection, meaning the bacteria are in their body but are inactive and cause no symptoms, and they cannot spread the disease. However, latent TB can progress to active TB disease if the immune system weakens. Symptoms of active TB disease can vary depending on the affected body part. General symptoms can occur with any form of active TB: fever, often low-grade chills, night sweats, drenching sweats during sleep, unexplained weight loss, loss of appetite, fatigue or weakness, general feeling of being unwell, malaise. Symptoms specific to pulmonary, lung, TB, a cough that lasts for 3 weeks or longer, coughing up blood or sputum, thick mucus, chest pain, especially with breathing or coughing. Symptoms for extrapulmonary TB will depend on the affected organ, for example, back pain for spinal TB, headache for brain TB, swollen lymph nodes for lymph node TB. People with latent TB have no symptoms and cannot spread the disease. Treatment for TB involves taking a combination of antibiotics for an extended period. The specific regimen and duration depend on whether it's latent or active TB, the location of the infection, and whether the strain of bacteria is drug resistant. Latent TB, typically treated with 1 or 2 antibiotics for 3 to 9 months to prevent the infection from becoming active TB disease. Active TB usually requires a multi-drug regimen, often 4 different antibiotics, for 6 to 9 months. Common first-line drugs include isoniazid, rifampin, pyrazinamide, and ethambutol. Drug-resistant TB requires more complex and longer treatment regimens, sometimes for several months to years, with different, often more toxic, medications. Crucially, it is essential to complete the entire course of medication as prescribed, even if symptoms improve or disappear. Stopping treatment early can lead to the bacteria becoming resistant to the drugs, making the TB much harder to treat and increasing the risk of spreading drug-resistant strains. People with active pulmonary TB are often advised to stay home and minimize contact with others for the first few weeks of treatment to prevent transmission.